Results on Wheels is a mobile service where we get to come to the patient. A lot of people have to get lab work done or want to get tested for COVID, strep, mono, whatever it may be, and this would allow us to come to them. One of the main goals is to provide patients with an alternative way of getting tested for some of those following things or getting lab work done. One of the biggest things is trying to decrease exposure. So the less amount of people that go into clinics wanting to get COVID tested, you're not going to have so many people waiting in a doctor's office. Right now, a lot of people are doing virtual doctor's appointments where, they're not face-to-face necessarily anymore. So if someone wants to get tested, it's very easy to get a doctor's order to do so. So basically, we would come to them, we would do a rapid test for whatever it may be, or collect specimens for their lab work. This is great for the elderly or people that are vulnerable to this pandemic right now and don't necessarily want to leave their house. Some of the opportunity costs that come with this is the shortage of medical supplies. Right now, I work in the medical field. There's been a few times where we couldn't get reagents or swabs or whatever it may be that we needed, so that would decrease revenue if we had to stop doing or performing a certain test. Another thing is, right now, healthcare workers, there's not enough of them, so employing enough people to do this might be a little tricky, especially with nurses and medical technologists, just because they're in very high demand. With supply and demand, some of the factors that there are the shortage of supplies and people, and also a lot of states have different policies when it comes to COVID and everything. For the economic factors with this, consumer index price is a big one. People don't want to pay for healthcare if they absolutely don't have to. It's expensive. Most people don't have health insurance, and I know that's the reason why a lot of people haven't got tested, because they can't afford it. Also right now, the unemployment rate is very, very high. So a lot of people have lost their jobs or have lost their health insurance. So those are some things to contribute just in case. No one wants to use it because of affordability. Competitor-wise, locally in my area, the only service that I've heard of that's even somewhat similar is at-home nurses or people who go and visit people nurse-wise. Usually those are set up, they're expensive. That's someone who visits a patient every day. Besides that, there's no other type of in-home healthcare where it's just convenient for getting a test done or lab work or whatever it may be instead of having to physically go there. But everywhere else, especially with COVID testing being so popular right now, they're more stationary. You have to go to them, wait in a line or whatever drive-through situation they have, and you get tested that way. But this would give people, different options of what to get tested for, not just COVID, but like I said, lab work, strep, whatever other rapid tests that there are. So there's more to it than just COVID. Some of the resources that would be needed in order to make this a running business would be fleet vehicles, employees, med techs, supplies, all the necessary medical technology that you need in order to run tests. Some of the downfalls when it comes to supplies is if you don't have it, then if you have to send it to an offsite lab, usually that increases the price for the patient. So with everything being kind of scarce right now, that is definitely one thing to take into factor that you might not be able to get your hands a hold of.